exam, filament test, and nerve conduction studies. The patient's diagnosed with diabetic neuralgia. A, E11.42, Z79.4. B, E10.42. R20.0, M79.604, M79.605, C, E13.42, and D, E10.42. A patient with type 1 diabetes on insulin presents with complaints of numbness and tingling in her feet and burning in her extremities. She also gets sharp pains in her legs at night. And then after that neuromuscular exam, filament test, and nerve conduction study, the patient's diagnosed with diabetic neuralgia. Coders, do your thing and solve this scenario. Your time begins now. Okay, coders, the time is almost up, and I noticed no one referenced the guidelines. So you got this. Do we have a guideline for this? I think we do, but a general one. Outstanding. Outstanding, outstanding. All right, so everyone said something different. So let's see how we solve this. We know this is type 1 diabetes mellitus. Look at A. Just saying. All right, on insulin. Okay, look at A. Just saying. With complaints of numbness, tingling in the feet, and burning in her extremities, and she has sharp pains at night, she's been diagnosed with diabetic neuralgia. All right, coders. Sounds like those signs and symptoms are integral to the diabetic neuralgia. All right, so I'm going to use my index and I'm going to look up diabetes. Diabetes type 1, right? With neuralgia. And it takes us to E10.42. Next, I'm going to verify E10.4, type 1 diabetes with neurologic complications. And then if I scroll down to E10.42, this is type 1 diabetes with diabetic polyneuropathy. And right up underneath that, type 1 diabetes mellitus with diabetic neuralgia. Same meaning. So that is our code, E10.42. And we have a guideline. And the guideline says, hey, these codes are combination codes, and also don't code any insulin with this. So we're going to get rid of C. C is the wrong category. We're going to get rid of B because they're coding signs and symptoms integral to a disease. And that's a combination code. No point in coding the integral items. And then A is coding for type 2. Our answer, D. And so what you do is you go to the diabetes and the index right here. Here's your instruction. Look up type 1 with neuralgia. And that's how you get your answer. And feel free to look up, to review this playback. You're going to get more the next time you see it. All right, so here's some final things about diabetic codes. I know we took a long time, but look at type 1. Just look at it. Remember, there's 1 in type 1, right? Type 2, there's 2 1s. Type 1, you do not code insulin with it. It's understood. Type 2, you can. And all diabetic codes are combination codes. They are. If they're not the non-specific codes, they're combination codes that include the type of diabetes, type 1 or 2, the body system affected, such as kidney and nerves, the complication affecting the body, such as CKD or neuropathy. Type 2 codes for insulin if the patient is if it's documented that they're using insulin, and type 1 you do not. And I think that's all. That's all. I think just the more you do it, coders, the better you'll become. We're not finished. No, we're not finished. We have a little more time to go, a little more to review. All right, so just want to let you know that obesity and body mass index is also in this chapter, in the endocrine chapter, or yeah, diseases of the endocrine system. So I just want to let you know that the code series is E65, the category series is E65 through E69. And BMI, if it's documented, it should be coded as well. And a BMI is calculated by using the height and weight and is used most often because it correlates with the amount of body fat that a person has. So it's used most often in integumentary and when you're coding for it. So just want to make you aware of the obesity codes. Code to the documentation. If the provider says the patient is obese, E66.0. If the documentation says the patient is morbidly obese, E66.01. If they're overweight, you use the overweight code, and you can use the BMI code Z68, the appropriate, depending upon their BMI range. Okay. And just code to the documentation. Don't try and determine anything. If the doctor does not say the patient is morbidly obese, I don't care if they are 500 pounds. We can't code it. We code the documentation. If we're able to query that doctor, then we query. But we do not label or diagnose the patient without the doctor. We don't diagnose the patient. That is not our scope of practice. We code to the documentation, and that's it. Now, when you get in the real world, your providers will give you some instruction, but right now, we are students, right? Okay, so the BMI is Z68 category, and then as you can see, the BMI levels are indicated. And just code accordingly. It's very straightforward. All right, I am finished. And now I want to hand it over for Mr. Sandeep, who's going to end things with eyes, pain, and psych. Okay, Mr. Sandeep, please and thank you.
Thanks for tuning in, and until next time, happy coding!